It's Wednesday, July 6th. I'm Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control at the University of Kansas Health System and an infectious disease physician. And this is Show Me the Science. Hope you all safely enjoyed your 4th of July celebrations this past weekend. Unfortunately for us here at the health system, 4th of July can be a very busy place here, especially in the emergency department and the burn unit. This year was no exception. We're talking all things burn today on Show Me the Science. The kinds of burns that keep our panelists up at night or are major concerns during the summer include burns from fireworks to asphalt and to the sun. Our panel of experts include Dr. Dhavel Bhavsar, Medical Director of our Burnett Burn Unit, and Nurse Case Manager Katherine Kimminau. But before we begin, I want you to know this is one of my favorite episodes we do every month because we get to dive into some kind of research and teach a little. Our study will focus on the sunburn and is published in the National Institutes of Health Library of Medicine. It was last updated in May, so it is current. If you've ever suffered a bad sunburn, you'll have a better understanding of what's happening to your skin after today, including how to treat it and when to seek medical care. But first, let's hear from our experts about activity here in the hospital over the 4th of July. So first, how busy were we in the burn unit in the emergency department this year because of sunburns or fireworks at this point?
Yeah. So, like you said, it really hits our inpatient burn unit, our emergency department, and our outpatient burn and wound clinic as well. Over the weekend from last Friday the 1st through yesterday the 5th, we did see 29 patients total for firework-related injuries. 24 of those identify as male and 5 female. Of those 29, we did admit 11 patients between burn, ortho, trauma, and other services. Age range-wise, it was between the ages of 5 and 53, so mostly adults, but we do also see pediatrics.
Yeah, and I bet a lot of those, again, the predominance was male. I bet a lot of those were probably in that late adolescent to early 30s or 40s because, of course, men tend to do things that are not the best decisions. So
the risk-taking behavior?
Absolutely, higher. What are typically the most common injuries then with fireworks that you see, Dr. Bhavsar?
So usually it will be hand and face. Hand when they are playing around with fireworks, firework that they lit and didn't go off, are curious, goes back, and either it kind of goes off in their hand or blasts in their face. Sometimes there is just playing around with fireworks in a way that that leads to the injury also. Again, most common would be hand and face.
Yeah, I think it's extremely important, especially when you start to talk about hand injuries in your dominant hand. So we know those occur quite frequently, obviously.
Absolutely.
So we'll talk extensively about sunburns here in a minute, but what are the other kinds of burns that are really most concerning to you, especially during these summer months? And I know there's a couple in the winter months as well that we've seen together.
True. As the weather starts warming up, I think we start seeing that kind of people get active. They in our area and the extended area around the kind of metro, it's not uncommon for people to get their trash in the burn barrels or in the farms that they burn their trash, their kind of grass, and those do lead to burn injuries when they're trying to kind of douse a lot of fuel to get them started, and then they're trying to kind of get that lighted. Suddenly, if the wind changes, if there is too much of fuel in the air, and they can get the burn injury to kind of because of that flash of that fire, they can get burned to themselves. And also in the backyard when they're doing the campfire, they're doing the barbecue, lighting it on, or sometimes kind of mixing the fire and alcohol leads to those like burn injuries also. And finally, like we have been having those 90-degree days like for a very long stretch. So even though the air temperature may be 90, the asphalt temperature would be probably another 10 to 20 degrees higher, and that can lead to asphalt-related contact burns if someone is not wearing kind of protective shoes, is walking on, has some other say issues, medical issues that doesn't allow them to understand how hot that is, can lead to the contact injury from hot asphalt also.
Yeah, and also when we do get burned, so this is an important step. When we do get burned, I know a lot of people want to run really cold water or put ice on it. What is actually the best method to go about post-burn or immediately after that burn to get your skin better, to get you healing?
So the first thing is to stop the burning process. For whatever caused the burn, get away from it, stop, drop, and roll always. Next, how to cool that area down. So with a cold running water, not ice water or not ice directly. We want to cool that area down, but we don't want you to be using ice because it can in effect lead to more injury if you apply ice directly for a very long time. Running tap water is good enough in most times, or you can have the water cool down. For small areas, you can even try to kind of say if it's hand and you want to kind of submerge in a cold water, that would be adequate.
And then in the next couple days, if it's a smaller burn, what is the best method? What are the best things to do to help treat that burn?
So if you see that there is skin peeling, there is blisters, it would be good to reach out to your primary care doctor. It would be good to reach out to a burn center in your area. It will be very useful. And those burn areas can be covered with like moisturizer, antibiotic ointment, but at the same time, I think if you do see that there are blisters, it's best to reach out to your doctor.
Yeah, so blisters is a huge sign that you probably need to seek some sort of medical attention just for
Correct.
assistance. Okay.
Yes.
So we're also going to talk about sunburns in a minute. So send in your questions to us on YouTube, Facebook, Twitter, the Medical News Network, Twitter, and the links are there on your screen as well. So right now, let's check our COVID count. Certainly in the hospital, we know that our numbers have kind of increased or stayed steady in those high 20s recently. Right now we have 28 patients in the hospital with 2 in the ICU, 2 on the ventilator, and we still have 15 in that recovery period as well. But I'd like to show some data that we did take because of community questions, just about what is the percentage of our vaccinees that are in the hospital with COVID. And this was put together by Amanda Cackler, who you all know works with us as well. So this was from a couple days ago. So this was when we had 26 active infections. But if you can see here, 6 had no record of vaccine documented, or it was unknown. 3 had the primary series that were incomplete, and 17 were overdue for the booster. So what we can say is that these people that were in the hospital are in the hospital for active infection. Were not up to date with their vaccination, and about 85% of those were here actually for COVID-related things such as shortness of breath or respiratory failure. So it still was causing disease. I think that's not unexpected, as we know that the virus is circulating quite a bit, but on the latest numbers around the nation for cases and hospitalizations, there currently is a slight downtrend, so that's always good as well. So moving away from that and the COVID numbers, let's talk about sunburns. And as usual, here are a few research terms you'll hear us use as well. The etiology of a sunburn explains the science of what specifically is happening when we have sunburns. And we will talk about that as well. So we'll also talk about the FITZPATRICK scale developed in 1975 by an American dermatologist, Thomas FITZPATRICK, to create a numerical classification of skin color that is used today in estimating the response of different skin types to ultraviolet light, and is used by doctors to assess skin cancer risk. Do you use this scale on the burn unit, Dr. Bhavsar?
We do. I think that is much more commonly used for other interventional kind of treatments or assessments. But definitely, when we're talking about the risk of sunburn, the people with the lightest skin color, blue eyes, and the least amount of melanin and the skin pigment have the highest risk for getting the sunburn. And that is because melanin is considered to be the protective element against a UV injury. It is not a complete, means if someone who has a good amount of melanin pigment, that they will not get a sunburn. It's just it provides a protection against sunburn for a longer period of time than the pale or the light color skin would be. And on the screen you're seeing the different types. So the type 1, 2, and 3 definitely have a much higher risk for getting the sunburn compared to the types 5 and 6.
Yeah. Well, also another big word we have, lots of syllables, histopathology. So the histopathology tells us what is happening at the cellular level to the epidermis and dermis. And this will tell us the impact of the sun damage, again, at that cellular level. So also, we'll identify some illnesses that make you more susceptible to sunburns as well. And finally, our research today is called a clinical pearl. It's based on clinical experience or observation when controlled data does not exist or there is little controlled data. Think of it as pearls of wisdom, and our experts today have plenty to offer when it comes to burns. So first of all, Dr. Bhavsar, the etiology of a sunburn is too much exposure to ultraviolet radiation from the sun or similar artificial sources like tanning beds. But tell us the histopathology. What is really happening to our skin at that cellular level?
So the UV radiation to the skin leads to the inflammation of the skin, and that leads to the swelling of the cells, injury to the cells in various parts of cells, including the nucleus where the DNA is. And those injuries can be something that can be repaired by the person, it's like automatically, or if the injury is too much, that cannot be repaired. But if those injured cells are the ones that over time can develop into cancer cells. Not each and every cell that's going to be injured in your kind of sunburn is going to lead to skin cancer, but each injury increases your chance of having future skin cancer. So primarily it's inflammation and the cell injury
damage. So also, we know that the UV rays from the sun are the strongest between 10 a.m. and 4 p.m. Do we not need sunscreen then outside of those times before 10, after 4? But also, what about cloudiness? Am I also safe? Do I not need any sunscreen when it's cloudy?
Whether it's cloudy or not, UV rays do pass through the atmosphere, and if it is during the daytime when you're outdoors and you're going to be outdoors for a prolonged period of time, you have to use sunscreen. That is always going to be protective. And invisible, like when you don't think the sun rays are passing through, the UV rays are definitely still passing through. Even though the maximum kind of sun rays or the UV rays would be between those times, you will still have a significant exposure and significant risk from sunburn during other times.
Mm-hmm. And then also we've heard a lot about ozone. What about either elevation, but also the impact of ozone? Different areas of the country and things like that.
Mm-hmm. Ozone is the protector against the UV radiation. And as we are having, and whether you believe in kind of global warming or not, or pollution or not, we are having changes in the ozone content in our upper atmosphere, which is protective. As it is deteriorating, there is more and more UV rays that are passing through, and in subtropics, there is more direct entry of the, say, sun rays as well as UV rays, which puts us into a higher risk level for getting the sunburn. And many times you do hear that on hot days when there is a more ozone depletion, you do kind of hear from our local TV channels talking about the UV, so ozone depletion. Yep. Those are also the days when you can have a higher chance of sunburns and UV exposure.
Yeah. So also something that I do have some more experience about, we know that medications or other chronic conditions or chronic diseases can both increase a person's risk of burning. Let's look at the list of drugs while we talk as well. I typically, in my practice, will use doxycycline a lot for people that need to be on long-term antibiotics. We will switch it to a cousin if we know they're going to be sun exposed, because people can get a purple type sun sensitivity reaction from that as well. In fact, I had to do that last week, switch a woman off doxycycline to another drug. But also other drugs that are commonly used in medicine, and people are on these quite a bit. Thiazide diuretics, sulfonamides, fluoroquinolones, NSAIDs or non-steroidal anti-inflammatory drugs, retinoids, St. John's wort, and other photosensitizing medication. These are used for a number of different things as well. Are you using any of these in your practice?
Some of these medications I do, or patients that I see are already on those medications.
Yeah. So also, we talked about medications, but also diseases. The list of diseases in this study included autoimmune diseases, infections, idiopathic, meaning we don't know what that disease process is, but also malignancies such as cutaneous lymphomas and other common dermatologic diseases like rosacea and acne, solar reactions such as solar allergies and congenital genetic mutations that can result in dry, itchy, often white, gray-looking skin as well. And we know for somebody, probably living around here, if you're in the southern latitudes, as opposed to maybe northern as much, but we know that a solar allergy can be quite devastating. Can people really be allergic to the sun?
So there is documented kind of studies, and there are in the textbooks that people do have solar allergy, and there is quite a few people who do have to absolutely avoid sun exposure to avoid significant skin injury. And those kind of who have solar allergy, if they are exposed to sun, will have significant kind of immediate sunburns and then epidermal loss. Yeah.
All right. So also, now again, getting into the science in this study, this study looked at 31,162 U.S. adults. 34% reported having at least one sunburn. The highest number of patients had skin types 1 through 3 on the FITZPATRICK scale because they have less melanin that blocks the UV radiation, as we talked about before. But what do you do if you are severely burned, how to treat it, and how to care for the pain? And again, when should we seek medical attention? We've heard those questions answered as well. Anything to add to those answers?
No, again, I think if you do get the sunburn, the first thing is to cool down the skin. Make sure that you do not peel the skin. Let the skin peel on its own. Apply a good moisturizer, not a very thick type of moisturizer that will in fact hold the heat in. Also use anti-inflammatory medications that will help reduce the inflammation of the skin, which also will help with the pain. The timeline for the swelling and the inflammatory reaction to dissipate is about 2 days, and the healing and the peeling will stop in about 5 days, and healing will happen within 7 days.
Yeah. Now, we've talked about skin types, but do you ever see severe sunburns among people with color?
We do. I think it eventually depends on how much exposure someone has. So I myself have had sunburn, so I'm not immune to the sunburn, and nobody is. Again, lighter the skin, higher the chance of sunburn, darker the skin, less. But again, after a while, even no amount of melanin can protect you from sunburn. We do know that people of color and darker skin do end up having skin cancers, and those are still related to some amount of, or at least part of it is related to sun exposure.
Yeah, and so we know there are several different types of the FITZPATRICK skin phototypes as well. Type 1, pale white skin, burns easily, you don't tan. Type 2, white skin, burns easily, tans with difficulty. Type 3, white skin, may burn but tans easily. Type 4, light brown, olive skin, hardly burns but tans easily. Type 5, brown skin, usually does not burn. Type 6, black skin, very unlikely to burn but comes darker with UV radiation exposure as well. So I think we've had a good primer on all of this and what to do. Do we have any reporter questions today? No. How about community questions, Jess?
I think I'm type 2. I was just trying to figure out what type I was on that scale. I think you're type 1 or 2 too, because we both have blue eyes and kind of paler skin. Can I say that?
I do wear a lot of sunscreen.
Yeah, well, and we were just talking about that before the show. So I did want to ask this question from Angie, from our experts. But what would be the #1 ingredient that you should look for when purchasing sunscreen?
Zinc oxide.
Yeah.
So usually we say that the physical blockers are better for overall protection, and they are kind of less, or they're protective against the sun injury and the UV radiation. At the same time, they're good for your skin.
So we should be looking for mineral-based, is that correct?
Correct. Mineral-based sun blockers are the better ones.
Okay, so then on that same note, and I hear this a lot too, but another question was, why don't experts recommend spray on sunblock? If you have a 50 or above and you're spraying it frequently, I mean, is it still effective?
Again, I wouldn't put myself as the biggest expert in area of the sun blockers, but at the same time, the spray-on does not evenly create layer. Most of the spray-on are not mineral-based, and that's why we don't think they're the best choice. Now, it doesn't mean that they do not provide any protection, but if I had to, I would choose the mineral-based the lotions as my first choice, and the spray-on as my backup.
So Aaron wants to know, can skin damage from sunburn ever be reversed even a little bit?
So say if you have one sunburn, and this is part of the study and the CDC website also, a single sunburn can increase your chance of future skin cancer. I don't think that means that one sunburn and you are definitely going to have skin cancer. At the same time, if you have a repeated injury, your chance of having skin cancer increases. Over time, say 5 or more, and your chance of skin cancer increases by double. And that further up, and then you definitely have a higher chance of having skin cancer and also having multiple skin cancers in future. Now, those injuries, can it be reversed? So the mild injury will heal well, and long term, some of those things will settle, but some cells that are injured are not easily removable. The surface, and so I'm a plastic surgeon also. I do take care of patients who have long-term effects of sunburn and then sun exposure, and that is the skin aging. That can be improved upon using different kind of modalities like laser and then skin peel, and that can help remove some of those cells. But at the same time, it is not possible to completely reverse the signs of solar kind of injury to the skin. Again, one and done is not, but if you have a repeated exposure over a long period of time, those are not completely reversible.
Yeah, and I think that's huge, Jess. You know, when we were kids and probably generations before that, sunscreen use wasn't done as frequently as it is now, and I think that messaging has gotten out, but certainly as a child had a lot of sunburns as well. So.
Well, that's exactly what I was going to say. In full disclosure, Dr. Bhavsar, actually, I am one of those patients that he has treated from somebody who has had exposure to sun back, 30 years ago when my mom would drop me off at the pool with a bottle of baby oil for 8 hours, and here we are. And so that was a question, is about, do we see any shifts in the way we sunscreen our kids today versus back in the day when it just wasn't around? Are we seeing any shift in the amount of maybe skin cancer cases that we're seeing?
So today's skin cancer cases that we see are from the exposure 10, 20, 30, 40, even 50 years back, and tanning bed use. I do think that, so the kids that I know and I see around, my own kids. Okay, so kids that I see today, like my own kids and kids around, I think they do use sunscreen more frequently and religiously. They do reapply. At the same time, I think, again, if someone who gets repeated sun exposure without protection, I think will have some skin kind of injury from that. My hope is, and I do think that we are very much aware that unprotected skin in sun can lead to, say, future skin cancer. And the way we are practicing sun protection, it should be decreasing. Unfortunately, the results will only be visible in another 10, 20, 30 years.
I know a lot of people living with regret back in the day because of all of the damage that has happened now. So we hear you there for sure. Catherine, I have a question for you from Jeannie. She says, I keep aloe lotion right there at the kitchen sink. I keep an aloe plant too because I burn myself a lot when I'm cooking. And she says she uses it for burns when she's cooking too. Is that pretty effective? I found that that's really effective in pulling burns out of your skin.
Yeah. Like we kind of discussed earlier, for minor burns, you can run some cool water over them and then use like a non-fragranced lotion or like aloe vera. Yeah.
So that kind of also goes to a question I was thinking about. When you are starting and working to discharge these patients from the hospital, are the things you're looking at, obviously if they have severe burns, maybe they have to go to a facility or they're going home. Are there specific things you're looking for either in the home or the facility to help them continue to recover?
Making sure that they have family support, I think, is huge. And then our nurses do a lot of education while patients are in the hospital to make sure that they fully grasp the dressing changes we're asking them to do as they go home, and that they have that family support to help them with that. And I think that's when our outpatient burn and wound clinic is a huge resource to us, that our patients are able to follow up frequently down there.
That's very important, especially whether it's sunburn or fireworks burns, or Dr. Bhavsar, as we've seen in the winter, heaters, burns. I think you're spot on with family support and being able to get that to help recover. So.
Absolutely.
Jess, any other questions?
Yeah, a couple more from our YouTube viewers today. This one says that they heard that if you get burned when you have your clothes on, people are taught to not take the clothes off. Can our guests just speak to that? Is that a recommendation, and why?
So if the burn happens when someone is wearing clothing, the clothing is on fire, it is important that we do remove the clothing. If the clothing is stuck to, that the burn clothing is stuck to the skin, do not try to pull it out or peel it off, because then you may end up doing more injury doing that. But again, if it's clothing is on fire, please remove the clothing.
Yeah.
She says years ago, creams used on burns contained silver. What is the current standard of care of serious burn bandaging?
Yeah, I can take this one. We still use some silver-based products today. Silver is an anti-infective, so that keeps that infection away from the burn tissue. Probably our biggest standard now is more like a bacitracin antibiotic ointment, so similar to Neosporin.
Dr. Hawkinson, that's it from in here. I'm going to send it back to you and get things wrapped up.
Yeah, I mean, good questions from our community as always. This has been a great discussion with our experts. So just kind of some final thoughts from our guests. Again, as we are heading, obviously we've passed the 4th of July, but going to be heading into the fall. People are still getting together. I'm sure people will still be blowing off fireworks, doing things like that. Yeah. Any final thoughts or comments, Dr. Bhavsar?
Right. So I think we talked a lot about the sun exposure, sunburn, and injury to the skin. And I think we focused a lot on say the skin cancer, which is definitely more important and potentially devastating kind of diagnosis someone can get. At the same time, I think skin aging is also related to the sun exposure. And then we do want to kind of say message that long-term sun exposure without protection can lead to kind of faster skin aging, and the signs of skin aging that we talk about, the fine wrinkles, the color changing, we call it dyschromia, brown spot, age spots, all are related to that, as well as some of the inflammatory conditions, including visible kind of veins, redness. All those are also associated with the sun exposure. So I think look out for both, worry about both, and we'll be happy to kind of see any patients who have any questions in future.
Yeah. And Katherine, how about from you?
Yeah, I think earlier when Dr. Bhavsar was mentioning kind of our common summer injuries we see with, grilling or fireworks, bonfires, fire pits, it's oftentimes something that someone's done a million times before, and it really only takes the one time to get seriously injured. I would just say hope everybody has a fun and safe summer.
Be safe. So, I'd also like to say, prevention is the best, and we do really promote prevention here, whether it's vaccination. Be up to date with your vaccines, all of them, but especially, obviously, the COVID vaccines. We saw that the vast majority of our patients were not up to date on their vaccines, whether it's cancer screening, colon cancer, breast cancer, any of those other screenings. But again, most importantly to this topic as well, sunscreen. Apply sunscreen. Try to avoid that burn as much as possible. So also, we would like to note that there is a grateful burn patient who is paying it forward with a gift that is nearly 4 decades in the making. Tim Stone was a patient here 37 years ago after a tragic motorcycle accident landed him in the hands of our burn unit team. The faces have changed, but his gratitude has not. Tim donated $5,000 to the Burnett Burn Center as a way to say thank you for helping him get his life back. He said he was glad to be back and was alive to share his story.
All I faintly remember is looking out the window of the ambulance and seeing a good friend of mine and his ex-wife, tears just rolling down their faces. And I knew then that it was pretty serious. Yeah, you guys are the best, that's for sure. I mean, I really don't know what else to say but to thank you guys, and thank you guys very much for what you do every day.
And Tim volunteers at our St. Francis location in Topeka. He says he plans to continue to donate more money so we can help more burn victims recover. Jessica, tell us about our guests on Friday.
All right, sure thing. All right, so Friday there's a big announcement relating to cancer coming up on Thursday. So mum's the word. We can't say a whole lot about it, but you'll want to tune in on Friday morning as we share all about what this big announcement means for cancer patients in our area. Big, big news coming.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.